So we hear a lot about the ALK Master Protocol, and can you walk us through kind of what that protocol is trying to achieve?
So this is a program through the NCI, and it's really trying to look at what is the role of biopsy. And so patients will undergo a biopsy at the time of disease progression. Then there's about 10 different cohorts of patients, and you'll be assigned based on your mutation type to either one or two or three drugs that have shown preclinical evidence of activity in that cohort. The other part is if you don't have a mutation, the ALK no mutations, you'll be randomly assigned to, I think there are about 5 drugs at this point, or chemotherapy to really see in those people without a known ALK tyrosine kinase mutation. The first 200 patients will get ctDNA collected.
I was going to ask you about blood.
And this was critical because I think when we look at the ctDNA data, sometimes the biopsy was done 6, 12 months or 2 or 3 therapies beforehand. This time we'll actually be able to pair the tumor biopsy, the ctDNA, and get a better sense of what the concordance and really what the negative predictive value is at this point. And I think it's an ambitious trial.
So it sounds like a very complicated trial.
It is complicated, and I think because I've had to present this at several times, and I think it's complicated, but if you take a step back and say, what questions are we trying to ask? And I think we're trying to ask, what is the predictive role of the ALK mutation, something that needs to be addressed? What is the role of ctDNA? And for the mutation negative, is chemotherapy coming back? Is that going to be the preferred therapy? And maybe ALK inhibition is not as active in those patients as it is in the people with the mutation. And if you boil it down to those 3 very common clinical questions, it's good. When I look at this trial, I think it's easy to think of it as a 2-step process. Get the biopsy, then get the biopsy result. And if you look at your specific mutation cohort, then it becomes either a 2-arm trial, 3-arm trial, and it's a little bit easier to digest. But it is a complex trial.
And in these situations, I can't help but think about a clinical investigator presenting this trial to a patient, and obviously the number of arms and the complexity of it. All of a sudden, you get into the land of confusion from the patient's point of view. Any concerns with the committee with regard to feasibility and accrual? I mean, obviously, this is not the most common thing we see in lung cancer in terms of patients.
I think feasibility is a justifiable concern at this point because it's a big trial of 660 patients. I think when I present it, I'm going to present first the biopsy.
Yeah, keep it simple.
Keep it simple.
Yeah.
Then when I'll discuss the therapeutic when I have the biopsy results back, because the analogy I've used with patients is sometimes this becomes like Alice in Wonderland. You open one door and 2 more doors open, and it becomes very confusing to the patients. I think it's also going to be confusing to some of the study teams, as they try and work through the logistics of this. So I think it's going to need a lot of patient education. I'm hoping the patient advocacy groups will also be strong proponents of this trial because they have a very strong voice and have a unique communication set that we don't have as doctors, frankly.
Right. And the trial does require a rebiopsy, so there is always issues with rebiopsy and that sort of thing.
So it will be a biopsy before enrollment, and that's covered, and then the testing is also covered.
Yeah.
And then at the time of progression on the trial, there's an optional rebiopsy at that time of progression, and we're going to obviously try and capture that data because that's going to be having paired biopsies is going to be sort of critical to understanding the emergence of resistance mechanisms.
And it's a population of patients that I think is very amenable to getting stuff like that done, right?
I rarely have a patient refuse a biopsy these days. I think the culture's changed among medical centers as well as the patients as they realize the utility of these tests.
So that's great. I mean, I think that if that trial could complete its accrual and address all of those objectives, I think it would be very informative in terms of how we manage this population.